Suicide. It's the second leading cause of death for all U.S. teens. And for gay, lesbian, and bisexual teens, it's attempted 2 to 7 times more than their heterosexual peers. But now a new study from the Johns Hopkins Bloomberg School of Public Health suggests that legalizing same-sex marriage was estimated to reduce suicide attempts by 134,000 per year, and an even greater reduction among lesbian, gay, and bisexual adolescents. So joining us now to talk about this topic is study leader Julia Raifman. She is the postdoctoral fellow in the Department of Epidemiology at the Bloomberg School of Public Health. Julia, thanks so much for coming in.
Thanks so much for having me.
So tell us how the study was conducted.
So we took advantage of a natural experiment that happened because different states passed same-sex marriage policies in different years. And so what we were able to do is compare 32 states that passed same-sex marriage policies to 15 states that didn't pass same-sex marriage policies by January 1st, 2015. And we looked at the rate of adolescent suicide attempts before and after same-sex marriage policies in those states that passed same-sex marriage and compared that to changes over time in states that didn't pass same-sex marriage. What we found is that that adolescent suicide attempts were really consistent over time in states that didn't pass same-sex marriage policies, and that we really saw this reduction in suicide attempts that happened in same-sex marriage states right after they passed the policies.
So what was the most surprising information that came out of it?
You know, I think I was most surprised just by the really large disparity that you mentioned at the beginning of the interview. 29% of lesbian, gay, and bisexual adolescents reported attempting suicide in the past 12 months, relative to just 6% of heterosexual adolescents.
So how do you think something like this will impact social policy going forward? Because there is a new administration, and from some communities are, fear that things could change.
Right. So I think it has a few important implications. So one is that I hope policymakers and the public will consider the potential health impacts on children of policies that govern LGBT rights, such as same-sex marriage policies. I think another is that I hope parents and teachers and medical professionals will become more aware of the disparities that affect LGBT populations and be able to better address those. I think one thing that's nice about this study is that we can all agree that reducing adolescent suicide attempts is a good thing.
So now, would you say that maybe members of the LGBT community felt more safe, or that there is a possibility down the road that they could have a meaningful relationship? Maybe that's why we saw a reduction in suicides?
Yeah, so I think it's a really interesting study because most adolescents will not marry in the immediate future.
This is several years apart.
Yeah, exactly. So we didn't directly analyze the mechanism by which same-sex marriage policies reduce adolescent suicide attempts, but we have a few hypotheses, and I think that would be a great area for further study. So it's possible that it gave adolescents more hope about the future, or that something about having equal rights made adolescents feel better about themselves and have reduced adolescent suicide attempts.
Did you have any surveys or questionnaires? Did you get a chance to get any comments or feedbacks from the juveniles?
So we used secondary data from the Centers for Disease Control and Prevention, and it was data that's representative of high school students in each state. So they did ask some questions about bullying and about depression, and so I think those are things that we hope to investigate in the future to try to better understand why we saw this effect.
Okay, all right, very, very good information, and hopefully something positive can come out of this.
Yeah, thank you very much.
All right, Julia Raifman, thank you very much for coming in.
Thank you very much for doing the interview. It's a pleasure to meet you, and
all right.
It's my first time doing this. So.
And you did an excellent job.
Thank you.
And